Hey y'all, Kayla Mowdy, Doctor of Physical Therapy, coming to you with another Monday educational moment. Today I'm going to talk about the pain spasm cycle. This is just what I call it to help relate the process to patients. It's kind of this cycle where at first you just have a small pain that might not be that big of a deal, just kind of an irritating thing in one area. And what happens is the muscles around this area kind of tighten down. So around that area that is already not functioning well, it quits moving. Pain is kind of a signal to our brain to kind of assess the situation back from our primal days when there were dangers as like animals or snakes and stuff like that that might have bitten you. So our body protects the area. It kind of just the muscles clamp down in the area and it doesn't move as well. So physical therapy, most physical therapists have lots of tricks and tools to teach you to break this pain spasm cycle. No matter what the original pain was, sometimes it's even hard for us to tease out what the original pain was because there's a lot of stuff going on depending on how long it's been going on. If it's chronic, there may be a lot of muscle spasms. Or other things, compensations, secondary dysfunction, just muscles not working together well because the first muscle quit working because it was protecting this area. So we have a lot of different things we can teach you to kind of break up that cycle. So I'm just going to give you some examples. The first thing is just breathing, relaxation techniques. There's some mental imagery to help relaxation, stretching the area, modifying tasks, exercising, dry needling is actually really effective for my patients to kind of break up that pain spasm cycle and let them kind of have a reset in the area that the complaint is, and then we can start retraining everything to work together well. And that leads us to next week's video. We're going to talk about synergies and how things are supposed to help and how each muscle has its own job that it's supposed to do. So y'all have a happy Monday. If you're having trouble breaking up that pain spasm cycle on your own, go ahead and come see a physical therapist. Bye, y'all.